Hello, I'm Otter and I'm here with Lindsay and Curtis, and in this video, we'll be discussing how the Affordable Care Act has impacted the current state of key hospital utilization measures, which include access, quality, and cost. Access to hospital inpatient services can be measured by using discharge rates and trends. Discharge rates and trends also measure the extent of utilization of hospital inpatient services. Hospital services has seen two phases of transformation. The expansion phase, which lasted up to the mid-1980s, saw a growth in medical technology which led to increases in the number of hospitals. This was because new surgical procedures were preferred to be conducted in a hospital or inpatient setting. The second phase was a downsizing phase, which lasted from the mid-1980s till the present. In this phase, we saw the Tax Equity and Fiscal Responsibility Act of 1982. Under this act, Medicare was only allowed to give hospitals a fixed amount of reimbursement per patient, regardless of how long the patient stays. In order to reduce the cost of extended patient stay, hospitals started to downsize their capacities, shorten length of stay, and increase the rate of early discharges, given that there was some community of care after the hospital. The ACA gave 30 million patients access to healthcare, but it controlled the access by reducing Medicare funding for hospital inpatient care. This shifted the cost of continuing patient care from inpatient to outpatient facilities. Among the non-elderly patients, Medicare, under the ACA, started to reduce its funding for hospital inpatient care. This resulted in a reduction of hospital utilization. A reduction of hospital utilization also led to a reduction of discharges because there were less beds being used. This spillover effect may cause shifts in the use of outpatient facilities and quality of care. In addition to access, let us now discuss the current state of the quality of care.
In 1998, the Advisory Commission on Consumer Protection and Quality in Healthcare Industry recognized the need to improve and sustain quality of care in the United States. The National Quality Forum is a public-private partnership that is focused on setting standards for healthcare quality. The National Quality Forum is considered the gold standard in measurement. The National Quality Strategy has identified 6 key areas that need to be improved to achieve better care, more affordable care, and healthier communities. These include person and family-centered care, care coordination, effective treatment, healthy living, and care affordability. 11 of the quality measures achieved a 95% performance level, some of which include hospital patient with heart attack given percutaneous coronary intervention within 90 minutes, patients 50 and up with pneumonia who received influenza screening or vaccination, as well as patients with pneumonia who received initial antibiotic dose within 6 hours.
Now let's look at hospital utilization costs. Since the inception of the Affordable Care Act, healthcare costs have still been steadily rising, but not as dramatically as before. Recent data has shown that a per capita spending increase of 4.6%, bringing the new total to $5,141 per person. Inpatient services costs have recently stayed the same, with only an increase in surgical admission, which rose by $15 per person. And outpatient services have risen from $53 in 2012 to $153 per person in 2015. Out-of-pocket spending rose 3% in 2015 to an average of $813 per capita spending on prescription drugs. Prescription drugs grew faster than spending on any other healthcare service. Part of this extra spending on prescription drugs has come from a per capita spending twice as high on brand prescriptions as on generic prescriptions. In 2015, $649 versus $313 in the previous year. Also, outpatient services and professional services have increased slightly in 2015, Data shows prices of outpatient, inpatient, professional services, and prescription drugs increased 3.5 to 9%. Here are our two discussion questions. Given the increase in outpatient care and the costs associated, do you think there are any provisions the ACA can provide that will reduce outpatient cost? Perhaps focus on preventative measure? 2. Is there a way to increase quality of care without increasing costs? Thank you for watching our video, and let us know about your thoughts on the discussion questions in the comments below.